proprioception, from Latin proprius, meaning one's own, individual, and perception, is the sense of the relative position of neighboring parts of the body and strength of effort being employed in movement. It is provided by proprioceptors in skeletal striated muscles and in joints. It is distinguished from exteroception, by which one perceives the outside world, and interoception, by which one perceives pain, hunger, etc., and the movement of internal organs. The brain integrates information from proprioception and from the vestibular system into its overall sense of body position, movement, and acceleration. The word kinesthesia has been used inconsistently to refer either to proprioception alone or to the brain's integration of proprioceptive and vestibular inputs. History of study. The position movement sensation was originally described in 1557 by Julius Caesar Scaliger as a sense of locomotion. Much later, in 1826, Charles Bell expounded the idea of a muscle sense, and this is credited with being one of the first described physiologic feedback mechanisms. Bell's idea was that commands are carried from the brain to the muscles, and that reports on the muscle's condition would be sent in the reverse direction. Later, in 1880, Henry Charlton Bastian suggested kinesthesia instead of muscle sense on the basis that some of the afferent information was coming from other structures including tendons, joints, and skin. In 1889, Alfred Goldscheder suggested a classification of kinesthesia into three types: muscle, tendon, and articular sensitivity. In 1906, Charles Scott Sherrington published a landmark work which introduced the terms proprioception, interoception, and exteroception. The exteroceptors are the organs responsible for information from outside the body such as the eyes, ears, mouth, and skin. The interoceptors then give information about the internal organs, while proprioception is awareness of movement derived from muscular, tendon, and articular sources. Such a system of classification has kept physiologists and anatomists searching for specialized nerve endings that transmit data on joint capsule and muscle tension. Muscle spindles are widely believed to play a large role in proprioception. Primary endings of muscle spindles respond to the size of a muscle length change and its speed, and contribute both to the sense of limb position and movement. Secondary endings of muscle spindles detect changes in muscle length, and thus supply information regarding only the sense of position. Essentially, muscle spindles are stretch receptors. It has been accepted that cutaneous receptors also contribute directly to proprioception by providing accurate perceptual information about joint position and movement, and this knowledge is combined with information from the muscle spindles. Components. A major component of proprioception is joint position sense, which is determined by measuring the accuracy of joint-to-euro angle replication. Clinical aspects of joint position sense are measured in joint position matching tests that measure a subject's ability to detect an externally imposed passive movement, or the ability to reposition a joint to a predetermined position. These involve an individual's ability to perceive the position of a joint without the aid of vision. Often it is assumed that the ability of one of these aspects will be related to another. However, experimental evidence suggests there is no strong relation between these two aspects. This suggests that while these components may well be related in a cognitive manner, they may in fact be physiologically separate. More recent work into the mechanism of ankle sprains suggests that the role of reflexes may be more limited due to their long latencies, as ankle sprain events occur in perhaps 100 milliseconds or less. In accordance, a model has been proposed to include a feed-forward component of proprioception, whereby the subject will also have central information about the body's position before attaining it. Kinesthesia is a key component in muscle memory and hand-eye coordination, and training can improve this sense. The ability to swing a golf club or to catch a ball requires a finely tuned sense of the position of the joints. This sense needs to become automatic through training to enable a person to concentrate on other aspects of performance, such as maintaining motivation or seeing where other people are. Basis of proprioceptive sense. The initiation of proprioception is the activation of a proprioreceptor in the periphery. The proprioceptive sense is believed to be composed of information from sensory neurons located in the inner ear and in the sketch receptors located in the muscles and the joint supporting ligaments. There are specific nerve receptors for this form of perception termed proprioceptors, just as there are specific receptors for pressure, light, temperature, sound, and other sensory experiences. Proprioceptors are sometimes known as adequate stimuli receptors. TRPN, a member of the transient receptor potential family of ion channels, has been found to be responsible for proprioception in fruit flies, nematode worms, African clawed frogs, and zebrafish. The human proprioceptor has yet to be discovered. Proprioception of the head stems from the muscles innervated by the trigeminal nerve, where the GSA fibers pass without synapsing in the Gasserian ganglion, reaching the mesencephalic tract and the mesencephalic nucleus of trigeminal nerve. Although it was known that finger kinesthesia relies on skin sensation, recent research has found that kinesthesia-based haptic perception relies strongly on the forces experienced during touch. This research allows the creation of virtual, illusory haptic shapes with different perceived qualities. Conscious and unconscious proprioception. In humans, a distinction is made between conscious proprioception and unconscious proprioception. Conscious proprioception is communicated by the posterior column medial lemniscus pathway to the cerebrum. Unconscious proprioception is communicated primarily via the dorsal spinocerebellar tract and ventral spinocerebellar tract, to the cerebellum. An unconscious reaction is seen in the human proprioceptive reflex, or writing reflex in the event that the body tilts in any direction, the person will cock their head back to level the eyes against the horizon. This is seen even in infants as soon as they gain control of their neck muscles. This control comes from the cerebellum, the part of the brain affecting balance. Applications: Field sobriety test. Proprioception is tested by American police officers using the field sobriety test to check for alcohol intoxication. The subject is required to touch his or her nose with eyes closed. People with normal proprioception may make an error of no more than 20 mm, while people suffering from impaired proprioception fail this test due to difficulty locating their limbs in space relative to their noses. Diagnosis: There are several relatively specific tests of the subject's ability to proprioception. These tests are used in the diagnosis of neurological disorders. They include the visual and tactile placing reflexes. Learning new skills. Proprioception is what allows someone to learn to walk in complete darkness without losing balance. During the learning of any new skill, sport, or art, it is usually necessary to become familiar with some proprioceptive tasks specific to that activity. Without the appropriate integration of proprioceptive input, an artist would not be able to brush paint onto a canvas without looking at the hand as it moved the brush over the canvas. It would be impossible to drive an automobile because a motorist would not be able to steer or use the pedals while looking at the road ahead. A person could not touch, type or perform ballet. And people would not even be able to walk without watching where they put their feet. Oliver Sacks has reported the case of a young woman who lost her proprioception due to a viral infection of her spinal cord. At first she could not move properly at all or even control her tone of voice. Later she relearned by using her sight and inner ear only for movement while using hearing to judge voice modulation. She eventually acquired a stiff and slow movement and nearly normal speech, which is believed to be the best possible in the absence of this sense. She could not judge effort involved in picking up objects and would grip them painfully to be sure she did not drop them. Training. The proprioceptive sense can be sharpened through study of many disciplines. Examples are the Feldenkrais method and the Alexander technique. Juggling trains reaction time, spatial location, and efficient movement. Standing on a wobble board or balance board is often used to retrain or increase proprioception abilities, particularly as physical therapy for ankle or knee injuries. Slacklining is another method to increase proprioception. Standing on one leg and various other body position challenges are also used in such disciplines as yoga, Wing Chun and Tai Chi. Several studies have shown that the efficacy of these types of training is increased by closing the eyes, because the eyes give invaluable feedback to establishing the moment-to-moment information of balance. There are even specific devices designed for proprioception training, such as the exercise ball, which works on balancing the abdominal and back muscles. Joint position matching. Joint position matching is an established protocol for measuring proprioception, and joint position sense specifically, without the aid of visual or vestibular information. During such tasks, individuals are blindfolded while a joint is moved to a specific angle for a given period of time, returned to neutral, and the subjects are asked to replicate the specified angle. Measured by constant and absolute errors, ability to accurately identify joint angles over a series of conditions is the most accurate means of determining proprioceptive acuity in isolation to date. Recent investigations have shown that hand dominance, participant age, active versus passive matching, and presentation time of the angle can all affect performance on joint position matching tasks. Joint position matching has been used in clinical settings in both the upper and lower extremities. Impairment. It has been seen that temporary loss or impairment of proprioception may happen periodically during growth, mostly during adolescence. Growth that might also influence this would be large increases or drops in body weight size due to fluctuations of fat and/or muscle content. It can also occur in those that gain new levels of flexibility, stretching, and contortion. A limb's being in a new range of motion never experienced can disrupt one's sense of location of that limb. Possible experiences include suddenly feeling that feet or legs are missing from one's mental self-image. Needing to look down at one's limbs to be sure they're still there. And falling down while walking, especially when attention is focused upon something other than the act of walking. Proprioception is occasionally impaired spontaneously, especially when one is tired. One's body may appear too large or too small, or parts of the body may appear distorted in size. Similar effects can sometimes occur during epilepsy or migraine auras. These effects are presumed to arise from abnormal stimulation of the part of the parietal cortex of the brain involved with integrating information from different parts of the body. Proprioceptive illusions can also be induced, such as the Pinocchio Illusion. The proprioceptive sense is often unnoticed because humans will adapt to a continuously present stimulus. This is called habituation, desensitization, or adaptation. The effect is that proprioceptive sensory impressions disappear, just as a scent can disappear over time. One practical advantage of this is that unnoticed actions or sensation continue in the background while an individual's attention can move to another concern. The Alexander technique addresses these issues. People that have a limb amputated may still have a confused sense of that limb's existence on their body, known as phantom limb syndrome. Phantom sensations can occur as passive proprioceptive sensations of the limb's presence, or more active sensations such as perceived movement, pressure, pain, itching, or temperature. There are a variety of theories concerning the etiology of phantom limb sensations and experience. Jack Tsaw, MD at Walter Reed Hospital, has advanced a theory based on the concept of proprioceptive memory. This theory argues that the brain retains a memory of specific limb positions and that after amputation there is a conflict between the visual system, which literally sees that the limb is missing, and the memory system which remembers the limb as a functioning part of the body. Phantom sensations and phantom pain may also occur after the removal of body parts other than the limbs, such as after amputation of the breast, extraction of a tooth, or removal of an eye. Temporary impairment of proprioception has also been known to occur from an overdose of vitamin B6. Most of the impaired function returns to normal shortly after the intake of vitamins returns to normal. Impairment can also be caused by cytotoxic factors such as chemotherapy. It has been proposed that even common tinnitus and the attendant hearing frequency gaps masked by the perceived sounds may cause erroneous proprioceptive information to the balance and comprehension centers of the brain, precipitating mild confusion. Proprioception is permanently impaired in patients that suffer from joint hypermobility or Ehlers-Danlos syndrome. It can also be permanently impaired from viral infections as reported by Sachs. The catastrophic effect of major proprioceptive loss is reviewed by Robles de la Tour. There is also some evidence that proprioception is impaired in autism spectrum disorders such as Asperger syndrome. Proprioception is also permanently impaired in physiological aging. See also. References. External links, Neuroscience Tutorial. See Basic Somatosensory Pathway, Eastern International College. Joint and bone Ehlers-Danlos joint hypermobility syndrome Proprioception. Humans have 6 senses, why does everyone think we only have 5? At Everything 2, Proprioception. This essay by Charles Wolfe takes its cue from such thinkers and artists as Charles Olson, Merleau-Ponty, James J. Gibson, and Andy Clark to illustrate the view of the priority of dynamic embodied activity over isolated mental and physical regions. To define this concept, WNYC Euro Radio Lab, Where Am I? Radio program looks at the relationship between the brain and the body. The Dancer's Mind ABC podcast on the nature of proprioception. Proprioception at the U.S. National Library of Medicine. Medical subject headings.